Your time starts now.
I work on Lassa fever prevalence in Nigeria. Okay, I'm shouting. Oh, Lassa fever is an acute viral hemorrhagic fever characterized with bleeding disorder and its terminal stage, resulting to death. It is caused by the Lassa virus, arenaviride, rodent-borne virus, and enveloped single-stranded bisegmented RNA virus. The reservoir for the virus is the mouse, known as Mastima natalensis, mostly seen in sub-Saharan Africa, which Nigeria is part of. Infection is by human contact with virus shedded in infected mouse urine, stool, and other body secretion, especially during dry season. Infection can also be from man to man when the body fluid of an infected person touches another person. The person can get infected. Though Lassa fever is endemic in West African countries, epidemic outbreaks are common and causes 300,000 to 500,000 cases annually, with approximately 5,000 deaths annually. Lassa fever outbreaks of the disease. Lassa outbreaks of the disease have been observed in Nigeria, Liberia, and some other West African countries, including Central African Republic. Knowing symptoms, non, though 80% of patients of Lassa fever can present with no symptoms, but non-symptoms are like the common fever, malaise, throat lesions, pneumonia, abnormal pain, vomiting, diarrhea, retrosternal pain, back pain, cough, conjunctivitis, or there can be facial swelling and also mucosa bleeding. All these are symptoms of Lassa fever. We can see the demographic spread in West Africa of Lassa fever. We can see along the coastal line of the Atlantic Ocean, we have a lot outbreaks of Lassa fever. Countries like Guinea, Sierra Leone, Liberia, and Nigeria, or including Central African Republic. But we can see where evidence of it has been demonstrated also serologically, Senegal, Mali, and in Congo. The problem, what is the problem? What is this write-up meant to solve? What am I trying to, resolve? With high modality, what made me go into working on it? With the data that have been shown that there is high mortality rate, up to 50% during epidemic, um, the available data show that this might lead to high morbidity and mortality rate in the country. Knowing the prevalence of Lassa fever in Nigeria and putting measures to eradicate the disease cannot be overemphasized. There's need to do something. The aim and objective of this study is to establish the prevalence of Lassa fever in Nigeria and also offer practical preventive interventions that can be implemented to reduce the morbidity and mortality rate. What was the method I used? Suspected blood samples were collected from patients, separated into serum, analyzed with reverse transcripted polymerase chain reaction. That's a chemical technique. And after the analysis, the results, the result analysis and discussion now. Significance of weekly detection of Lassa fever infection. Number of suspect and laboratory confirmed cases in 14 states of the Federation were determined using person care square. Significance of the death rate in states with Lassa fever was also determined using SPS at 95 confidence interval. You taking p-value less than 0.05. Then the analysis, what was gotten from the result after using this to analyze. It was observed that there is no significant difference in weekly detection of Lassa fever among the suspected and laboratory confirmation of the cases. This indicates that laboratory suspects were not significantly detected based on weekly laboratory examination. Lassa fever suspects were detected at any week of the survey. There was no particular week that everything was detected. The detection was spread throughout the week. Death rate recorded in this study was significant with the laboratory detection of suspects and their confirmatory results. This further suggests that most of the confirmed cases resulted in death. Weekly examination of the subject showed significant prevalence rate of Lassa fever in all the states, all the 14 states and 27 local governments that were involved. Prevalence rate obtained in this study at weekly examination of Lassa fever suggests continuous spread of Lassa fever infection in all affected states of the Federation. This is a cause for concern, and these are the references and conclusion. From the study, a steady increase in the death rates due to incidence of Lassa fever in all the 27 local governments and 14 states surveyed was observed. This suggests a looming deadly epidemic which could keep claiming many lives if not arrested on time. Lassa fever is hemorrhagic fever with very high frequency of transmission. Primary transmission of the virus can be prevented by avoiding human contact with its host, mastomys rodents, to humans, especially in outbreak regions. Preventive precautions against contact with infected patient secretions and proper education of people in high-risk areas about the causative agent, control and prevention of Lassa fever should be taken, especially with the government of Nigeria. Also, prompt preventive action from government agencies should be instituted so as to further reduce morbidity and mortality from epidemics of Lassa fever in Nigeria. Thank you.